I think 20 years ago we were complaining we don't have any data at all. So
Yeah.
what can we do? Now we are complaining we have so much data. What can we do? I think having a lot of data is great, especially for research. So in clinical practice, we may not need all of them. So first of all, we have to decide like what should we looking at? Are we looking at the last 2 weeks? Are we looking at last 1 week? Are we looking at last 1 month? So the current consensus is right now, even though it has its own issues and the pros and cons, it's suggesting looking at the last 2 weeks. So based on the CGM metrics and AID, we can focus on the last 2 weeks, and then we can try to compare them. Most of the systems compare your last 2 weeks, or whenever you want, you can customize that, and then we can just look at this data. But obviously, every system is different. There are so many different systems. There are pages and pages. So you have to prioritize what you need to focus. And in terms of your downloading platforms, in terms of your using your data, especially time should be sufficient when you are taking care of people with type 1 diabetes. Unfortunately, most of the physicians say they don't have time, and they see patients back to back, so they sometimes get a little scared of looking at a lot of data. So you have to be very precise and looking at as low as data but as sufficient as possible.